The Diffuse-3 study is a trial that was funded by the National Institute of Health. We coordinated at the University of Cincinnati. We're very excited about the trial because it really demonstrated for the first time that we can treat patients successfully beyond 6 hours after their symptoms. The Diffuse-3 trial really changes stroke therapy for our entire country. Before, we knew that if we were going to put a catheter into the groin and pull out a blood clot that was blocking an artery in the brain, we had to do that within 6 hours after onset. With this trial, we know now that we can go 6 to 16 and maybe even 24 hours after onset, being able to put the catheter into the artery and pull out the clot and improve outcome. But to do this, we also need to be able to get a special brain picture in order to make sure we are selecting the right patients. This is a particular brain image that's used with this CAT scan, but it's also giving a dye, a contrast that allows us to look and see how blood is flowing in the brain. This is a type of software and image that's only done at the UC Medical Center. And what you see here is, on the left, an area that looks pink. That's the area of the brain where the blood flow is so low that that brain area is likely already dead. The other side, the green area, is an area where the blood flow is low, but maybe not enough yet for the brain to die. So if we have a large area of the green and a small area of the pink, we know that's somebody who could benefit from therapy. Time is brain when it comes to stroke, but everybody has a different clock. It ticks at a different rate. For some, the ticking goes very fast and we don't have much time at all. For others, the clock is ticking slower, and we can be able to identify those people by brain imaging who has a slow clock and who may still benefit from therapy. Diffuse-3 is going to have a big impact on clinical practice because we're going to have a lot more people who will be eligible for stroke therapy. Before, we were limited to that 6-hour window. Now we're going out to maybe up to even 24 hours.